This is the nasal spine of frontal bone. This is the nasal bone. This is the vertical plate of ethmoid bone, lateral nasal cartilage, septal cartilage. Then this is the nasal crest of maxilla. This is the vomer bone. Then this is the sphenoid bone, a part of the sphenoid bone, nasal crest of sphenoid bone. And the nasal septum comprises 5 bones, as we have seen above: vertical plate of ethmoid bone, vomer bone, maxilla and palatine bone, sphenoid bones, and septal cartilage. Paranasal sinuses is made of these 4 bones: frontal, maxillary, ethmoid, and sphenoid. The maxillary sinus is lined by Schneiderian membrane. The nasolacrimal apparatus. Now we are seeing the each apparatus draining into which all locations. The nasolacrimal apparatus into the inferior meatus, frontal sinuses into the middle meatus, which is called as hiatus semilunaris, that is below the middle concha. Maxillary sinus open into middle meatus, called as the ostium, which is present within hiatus semilunaris. Ethmoid sinuses, both the anterior, middle, and posterior ethmoid sinuses open into the middle meatus, which is within the hiatus semilunaris and ethmoidal bullae respectively. Also, it drains into the superior meatus. The sphenoid sinuses open into the sphenoethmoidal recess of nasal cavity. The surgical approach to pituitary gland is through the sphenoid sinus. The middle meatus contains openings for the frontal sinus, anterior and middle ethmoidal sinuses, and maxillary sinuses. Here you can see 3 ethmoidal sinuses. So these are also ethmoidal sinuses. This is the greater wing of sphenoid. This is the inferior orbital fissure. No, this is superior orbital fissure. This is the inferior orbital fissure. This is the middle nasal meatus. This is the maxillary hiatus, which opens into the maxillary sinus. This is the vomer bone, inferior nasal concha. This is the middle nasal concha. This is the middle nasal concha. This is also middle nasal concha. Now this is the palatine process of the maxilla, alveolar process of maxilla, and this is the maxillary molar tooth. From this you can understand that this at the level of maxillary molar tooth, if you cut the skull, you can see the ethmoidal sinuses, the vomer bone, and the nasal septum. This is the zygomatic bone, inferior orbital fissure. Then this is the temporal bone. This is the perpendicular lamina of the ethmoid bone, superior orbital fissure, crista galli, and this is the orbital portion of frontal bone. Now here you can see the nasal bone here. This is the lateral nasal cartilage. This is the nasal septal cartilage. This is the greater alar cartilage, and this is the lesser alar cartilage. So you can see the nose is made up of all cartilages. It is at the level of maxillary molar tooth you can see the bones. Now cartilage of the external nose is hyaline cartilage. So you can just summarize: the external nose contains the nasal bones, septal cartilages, lateral cartilages, and alar cartilages. Now coming to the mandible, which is the largest and strongest bone of the face. Lower jaw houses lower teeth. It consists of body, which is curved and horizontal, rami, which consists of 2 perpendicular portions, right and left. Body and rami are united at angle nearly 90 degrees. Has a coronoid process, which is an attachment of the temporalis muscle. It also has a condyle. The mandibular canal traverses the mandibular body and opens anteriorly at the mental foramen. Now about the mandibular foramen. It is located on the medial side of the ramus, between the anterior and posterior borders of the ramus. It passes the inferior alveolar nerve, inferior alveolar artery and vein. So these two contents, two contents are the ones which passes through the mandibular foramen. So the mandibular foramen is located below lingula. Now the middle foramen, it is located below the second premolar on each side. It passes mental nerve, inferior alveolar nerve that exits as a mental nerve. It supplies skin and mucous membrane of the middle region. It also has the incisive branch. Incisive branch which supplies the pulp chambers of the anterior teeth and the adjacent mucous membrane. So mental foramen passes mental nerve and incisive branch. The lingula is a tongue-shaped projection above the mandibular foramen where the sphenomandibular ligament attaches.